Welcome, welcome. Today we have with us Anna Biskup. Thanks for being with us today. And can you introduce yourself and tell us a little bit about what you do?
Yeah, I'm a physical therapist for last 29 years, actually it's almost 30 years. I had graduated in Poland and came here those 29 years ago. Had started working in physical therapy outpatient offices for the first 10 years, and then from Chicago I moved to Colorado. Then I worked there both in outpatient and independent living facility as a physical therapist and program director, and started home health there. And I moved here to Utah 10 years ago, and all of this I had done in in a home health setting, because that's really what I found out is actually the most rewarding, most interesting, and that's what I'm happy with right now.
That's awesome. I love that. Well, the purpose of this video today is we're going to talk more about home health in this aspect of physical therapy.
Right.
And just kind of dive into what it is, what's the difference between that and outpatient therapy. So let's just dive right into it. So the first question, just to kind of give someone of a background, is what is home physical therapy?
Yeah. So physical therapy in general, right, is a treatment of the disease or, injury. So it's a therapy, definitely, right, to improve something what has been lost. Now, we do it in outpatient, right? When people were coming and we assessed them and we decided what can we do to help them the most, quickly to regain their functional mobilities. And the same thing we do at home. Mm-hmm. The only one difference is at home you have to be, in order to qualify for most of, it's actually mainly dictated by insurances, you have to be homebound. That's why you cannot make it to outpatient physical therapy unless, certain insurances will say, yeah, you can have it even if you're not homebound, you have it at home. But most of the primary insurances would say, yes, if you're not homebound, you cannot receive it at home. There is not really a huge difference between home health therapy and outpatient physical therapy. It's still physical therapy. Mm-hmm. The therapist is going to come to do evaluation. The therapist is going to decide what are the interventions we can use to help you to regain your function, right, or injury, or how to recover. But there is the difference is between outpatient and home health is you actually at home we can do a little bit more as far as safety. So people are not aware. People fall, if it's outside of the house, for this and this reason, somebody tripped. But if it is because you actually had some hazard situation at home, people might not be aware of it. So when therapist is at home, they can really assess it quickly, mm-hmm. and they can prevent you from some injuries, especially falls. And also home health therapy is used for often right after injury, right after surgery. People thinking, oh, I don't need any physical therapy. My doctor told me I'm not going to start any physical therapy until like 3 months after my spinal surgery. And they said, yeah, that's true. You're not going to do any specific exercises for spine. But in the meantime, how about protection of that injured or a surgical site? I have sometimes people who come to me and, it's their third surgery. They never had physical therapy for spinal fusion, for example, and then they end up, it's like, oh, I didn't know that there was so much I should know or I should protect myself from, a certain movement, how to get in and out of the bed. Sometimes people are taught this in the hospital, but it's so early in the stage, but they are already a little bit more under drug influence. They might not remember it. Family members might not even pay attention to it so much, mm-hmm. and until later on when it's so dangerous or important to remember. So that's the main difference. Again, we're still in outpatient physical therapy. We do use modalities, like, of course, hot pack, cold packs, electrical stimulation, and ultrasound, other things too. In home settings, the good outpatient physical therapists will have all this equipment. The good home health physical therapy therapists will have other equipments. I do have electrical stimulation at acupuncture points that I use, mm-hmm. that is easy to carry. I also have electrical stimulation interferential or TENS, which sometimes, depending on the patient, they might need it. I can use it in the home setting. I can train the patient to get similar unit and train them how to use it. So it could be, as far as using the equipment, it could be as intense as it could be in outpatient. Mm-hmm. It really is based on therapy skills and abilities, and of course patient needs. But it is very, very close, except it has a little different point, and often it's to get them ready to go to outpatient. So it's just a medium stage between surgery and outpatient, approach.
Yeah, totally. And so you've kind of already covered this point of what the difference is between the outpatient and home therapy. The next question is who is home therapy for? It's kind of more people that are homebound. Can you kind of elaborate on that?
Right. Well, anybody can be homebound on temporary basis, right? Mm-hmm. So let's say if somebody would have knee surgery, it doesn't need to be knee replacement, but most of the time when we get a little older, we're a little bit more restricted on the things what we can do. Mm-hmm. And nowadays there is let's say a few years ago, there was still tendency, people who had knee surgery would have at least, they would stay in the hospital for at least a few days before they being discharged home. Right now, we have more and more patients who are just in the hospital for that one day surgery. Mm-hmm. Next day they home. So, and they should start physical therapy right away. And movement is very, very important for many surgical interventions. So we do that immediately at home. And for this, sometimes people would say, oh, we're not ready. Oh, I'm not ready for it. Well, a certain things is you just have to do. That's what is going to be better for you to start right away. So we do that home therapy for people after surgery. Of course, it could be, again, a fall. Hopefully not tragic, If you end up with surgery, that's exactly following that first scenario. But let's say you're not, but you're really injured, you're sore all over, and you're older and frail, and you need to protect yourself for next time. So that would be two. Any diseases that have, a point that suddenly they got worse, Parkinson, any cardiac, or pretty much all the medical problems could be suddenly getting more intense. They can receive physical therapy first at home again. At one point, and most of the time the goal is to get them ready for outpatient. If they're able to tolerate getting out of the house and not being exhausted, right? And being able to, do at least basic activities without, severe fatigue, that means they can probably get to outpatient. And, there are criteria in home health that we use to say if somebody is homebound, even temporary or not. And that will help people to determine. Usually we make this decision together with patient and therapist. It's a conversation, it's assessment, mm-hmm. based on this. Are they safe or not to go out alone? And usually that's the goal, unless they have somebody to drive and so on. So those ones are factors outside, that we kind of consider to help them to decide.
Totally. And you've kind of already mentioned a little bit about the different tools that you use. Can you elaborate a little bit on that? What tools do you use in home health or home physical therapy? Again,
it's the same tools that we use everywhere in physical therapy. Again, it is based on probably therapist experience and expertise, but at least in home settings, when you think about this, anything that you carry with you, you can use, which means kinesiotaping, right? I mentioned different type of electrical stimulation. The hot cold packs, that's usually what people should have at home. If they don't, we can recommend that equipment. Physical therapy, together with occupational therapy too, we do recommend a lot of different equipment. Let's say somebody had a stroke, you don't think about this, when they discharge them from rehab and they coming home until they go to outpatient, they might not be safe. And, it's amazing, even I learn every year, I had seen different equipment like little handle that you put in the door of the car that actually helps people to get in and out of the car easier. And people sometimes being discharged from even rehab places, which I thought that, well, again, they teach them how to get in and out of the car because that's important, that's safety issue. But sometimes they come up and they still don't have that much. With sometimes modified wheelchairs, we recommend certain equipment, assistive devices to walk with. Is it appropriate for somebody, to use the walker or walking sticks? What is safer? Many people with Parkinson's disease would need something, but nobody for sure wants to use a walker. Oh, no, it looks like I'm old, I don't want to use it. You use the walker temporarily to get yourself mobile. And I would say that's better than not using anything or not using cane and not walking at all because I'm afraid of falling.
Yeah.
So sometimes it's the, decision making on what is the best for a given patient.
Totally.
But that would be, so we recommend equipment. And again, same thing, like we recommend modification of the home. Well, how about if you move this, if your oxygen tube is getting stuck on this piece of furniture, can we arrange it? That's what I find myself very liking actually in home health, because, in outpatient, people come and you just have them just right now. Whatever they told you, that's true. In home setting, you can really watch them doing things.
Yeah, so that's more in the actual, where they're going to be.
Right, and sometimes they're not even aware that certain things they had done that could put them in risk. And it's like, oh, I never thought about this. Simple thing like raise your couch a little bit higher. There are razors that you can get. So again, your knee is not going to be so sore after surgery. And every single time you get up and down, you have ability to bend it and extend it. If the chair is too low, you end up keeping it straight because it hurts so much. So people end up less mobile, So those little modification for home is also, one thing what outpatient therapists cannot do, but home health can, because they just see what you're really in.
Yeah, it's cool because it seems like it's a lot more custom approach to that physical therapy.
Yeah.
So that's really cool. So our next question, which is actually our last question, is where can someone go to find a good home physical therapist?
Yeah, that's a good question. Of course, nowadays, in this time, you open your internet, you look physical therapy. Again, every single place, if we're talking about home health has, it's a little bit more unique. Again, nobody really knows until you're in the physical therapy and you work with somebody, and people might not have experience of it yet. So the best way you would be, yes, you're looking at, I know people tell me, I found you, I look at the Google reviews and I went for who is the physical therapy, place or, person good, and I found you, and, you guys, Applegate had perfect, reviews. So it really goes back on what people would think about us, how we work with people. Of course, it does take a little bit more effort because people have to take that little extra step after they have been discharged. But there are also national rankings, that you can go on and find out physical therapy, in your area, or home health. Again, we have different varieties of physical therapy again. So you can choose outpatient, right? And more specific, if it's neurological or orthopedics. There is usually a lot of clinics, orthopedics, but talking to any of professionals, the doctor can refer you somewhere to. But pretty much you open the internet and you would find what you need. But again, if you want to be a little bit more precise, right, and you want to know which company in home health setting had done a good job, you can look at those nationwide, reviews, or again, just the simple Google reviews, and that would be all the truth coming through. Yeah.
Perfect. And then I guess actually I'm just going to throw one more question in here, is how is it usually paid for?
Well, again, when you have insurance, the insurance have a plan, right? Home health physical therapy is considered like an acute care. So let's say you in a hospital, and of course, depending on what kind of insurance you have. So majority of people will have just a regular insurance. When you're younger than 65, those insurances have certain, sometimes restriction as how many visits could you have at home. Do you need to be homebound or not? Again, some people choose to have therapy at home rather than going to outpatient. If they have therapies that they're very comfortable with, and many people actually just have equipment at home, even gym and so on. So that's very, very easy. But those insurances, so again, for younger people, the insurance will possibly say, yes, with this and this injury, you have that many visits at home. When you older than 65 or 65 or older, Medicare will cover, again, home health, physical therapy, occupational speech, and or nursing too. If you have, a Medicare, but so again, the first part, it's Medicare in the hospital, it's Medicare A. Home health is also Medicare A. Outpatient is Medicare B. It's just the different parts of Medicare. So again, when people done with hospital care, they kind of extending that care again through home right before they go to outpatient. So Medicare does not restrict how many visits numbers you have for home health physical therapy. It's all based on, assessment of that physical therapist and patient needs at this time.
Cool.
Yeah.
Well, sweet. Thank you so much, Anya. Thank you for your time.
Yep. No, you're welcome.